Hello, my research project is on gestural facilitation of naming treatment of word retrieval problems in aphasia. And aphasia is a receptive and expressive language impairment due to an acquired brain injury that affects auditory comprehension, reading comprehension, spoken expression, and written expression. Aphasia is not attributed to any other deficit and is disproportionately worse with words than any other modality. This language problem causes reduced availability, reduced access to words in appropriate time, and reduced auditory retention. And this definition of aphasia is in the notes section below. Now, one of the most common symptoms of aphasia is called anomia, which is the inability or impaired ability to retrieve and produce words. And anomic aphasia contains vague words such as thing, that, you know, and also circumlocutions, which is when the patient is talking around the target word. They just cannot seem to find the word they are trying to say. And gestural facilitation of naming is a treatment approach that uses gestural interventions to facilitate verbalization. Brookshire and McNeil call it intersystematic reorganization, is when non-speech behaviors such as gesturing are used to aid in communication. So the first treatment study I reviewed was called a comparison of intention and pantomime gesture treatment for noun retrieval in people with aphasia. And the purpose of this study was to compare the outcomes of intention gesture treatment to pantomime gesture treatment for the remediation of noun retrieval in the aphasic participants. Now, some gestural techniques include pantomime gestures, which are complex hand gestures that resemble the target word concept. Iconic gestures are complex hand gestures that represent the concept of the target word. Intention gestures are complex but meaningless movement without specific content requirements. And pointing is when you actually point to the object with your finger. Now, the participants in this study were 2 females and 2 males who were both native English speaking. The participants were right-handed, and the age range was 40 to 74 years old. All 4 participants were diagnosed with aphasia and word retrieval issues, and they were also diagnosed with limb apraxia. In order to set baselines, the researchers set out 200 black and white gestural noun drawings, and they were presented to each of the participants for 10 seconds. 60 of the pictures that were named incorrectly, 2 out of the 3 baselining sessions, were chosen as the experimental stimuli. So the 60 pictures were divided into 3 groups of 20. The first group was 20 pictures to be used in intention gesture treatment. The second group was 20 pictures to be used in pantomime gesture treatment. And the third group was 20 pictures to be used with no treatment to serve as a control. So the procedures went like this. There was 10 sessions followed by a 7-day intermission before the next training phase. And treatment happened 2 to 3 times a week for 45 to 60 minutes. So the first type of therapy that was tested was intention gesture therapy, also abbreviated as IGT. So participants used a circular left-handed gesture, then pushed a red button which was placed on the computer screen to change the picture in order to view the IGT target word. Inaccurate responses caused the clinician to model the intention gesture and verbally say the word 2 times. Then the participant had to imitate this gesture and verbal production 4 to 6 times. Pantomime gesture treatment went like this. The clinician trained target pantomime gestures during the initial session. The clinician would push the red button to target a PGT noun. Inaccurate responses caused the clinician to model the pantomime gesture with verbal production of the word 2 times. The participant then had to imitate and practice the paired production 4 to 6 times. And this study was concluded by a 1-month follow-up maintenance session. The results of this study show that intention gesture therapy did improve verbal naming skills in 2 participants, but did not carry over to untrained words. However, pantomime gesture therapy led to increased use of gestures to facilitate verbal naming in 2 of the participants and immediate effects of gesture productions in 3 participants, with carryover of gesture production to untrained words in 1 participant. The next study that I reviewed was called The Hands Have It, the facilitation effects of arm and hand gesture on word retrieval in aphasia. And the purpose of this study was to investigate the possible facilitation effects of spontaneous gestures on word-finding difficulties in individuals with aphasia. And the participants were 9 females and 9 males, so 18 participants in total. And the age range of these participants was 40 to 80 years old. They were also native English speaking. And all of the participants suffered from a single unilateral left hemisphere cerebrovascular accident. So the procedure was started by eliciting a natural communication sample from each participant. And this sample was then analyzed for 3 linguistic aspects: word retrieval difficulty, resolved word retrieval, and fluent utterances. The sample was also analyzed for gestural aspects. It was analyzed if it was a meaning Latin gesture, which are gestures related to the word. And some examples of meaning Latin gestures are iconic gestures, which are contextual, simple, and concrete descriptions of the word. Pantomime gestures, which are complex hand motions. And emblems, which are familiar movements, such as writing letter in the air and commonly understood signals. So a thumbs up or making an okay with your finger would be an emblem, would be an example of emblems. And it was also analyzed if it was a beat gesture, which are non-representative, and their sole function is to accentuate the speech segments. So beat gestures are hand motions that move simultaneously with the rhythm of speech. And the results of this study show that more gestures were used in the occurrence of word retrieval difficulty than during fluent speech, which would make sense because if the speech is fluent, they don't need gestures to help them. More gestures were produced during unresolved word retrieval events versus resolved word retrieval events. So we see that in order to resolve the word retrieval difficulty, more gestures had to be used. And the majority of the resolved word retrieval difficulty occurred within 0 to 3 seconds of the gesture onset. 93.8% of the gestures used in resolved word retrieval difficulty were meaning Latin gestures. Beat gestures only accounted for 6.2%. So for aphasic patients, beat gestures are not that helpful because they'll just accentuate the syllables of the word, but they're not really going to help them find the word that they're trying to say. So we see that meaning Latin gestures were successful the majority of the time. Specifically, meaning Latin gestures occurred more frequently during word retrieval difficulties than during fluent utterances. And more high imageability words occurred with meaning Latin gestures than low imageability words, such as words that are easy to imagine, such as a cup. You can pick up your hand and pretend you're drinking from a cup. Or a phone, you can take your hand and make it look like you're holding a phone up to your ear. But abstract words that are hard to imagine are difficult to use with gestures because there's no way to make a representation of the word that you are trying to say. And what I learned from both of these studies is that there are various types of gestures that can help individuals with aphasia find the words that they are trying to say, such as pantomime gestures, intention gestures, iconic gestures, emblems, beat gestures. Both studies show that there are many ways to help aphasic patients find the word that they are trying to say using gestural facilitation. And one other thing to keep in mind is that gesture production is multifunctional. It does not always facilitate word retrieval, which we saw from some of the participants in the studies. But it can act as an excellent compensatory strategy to either retrieve the word or to use the gesture as a way to communicate and get the idea across. If a patient is so severe that a gesture is not even going to help them find the word they are trying to say, at least a gesture can act as a compensatory strategy and help them get their idea across. So it is an excellent way in helping our aphasic patients try to get their ideas across, and we hope to help them find the words that they are trying to say. And here are my sources. And I hope you enjoyed this presentation. I really learned a lot, and I think it is something that I will be able to take into my clinical practice. Thank you.